Newborn screening for Pompe disease was added to the recommended uniform screening panel in the year 2015, and I take a lot of pride in stating that I pioneered this and endeavored since the year 2008, of course, with colleagues to move this forward. North Carolina actually has embarked on newborn screening for our state about 10 days ago, so a very exciting moment for us. The aspect of newborn screening is what we are uncovering is that the prevalence or the frequency of Pompe disease is way more than what we had previously thought. We had thought it was about 1 in 40,000, but here, depending on different states, it's anywhere from 1 in 9,000 to 1 in 24,000. Which also brings up another question: what is the distribution of cases? And still, about 20% are infantile cases, and the vast majority, that's about 80 to 85%, are patients with late-onset Pompe disease. And a question that constantly comes up is, what do you do with these babies? And so we have actually been very systematically following these babies identified with late-onset Pompe disease by newborn screening, and taking a very multidisciplinary approach to care, including physical therapy, which is functional measures, but also kinematic postural measures, by which I mean what would a typically developing baby do versus someone with Pompe disease who could be very much in that same spectrum, but we're finding subtle differences. In fact, a group of findings which very much mirrors what we are seeing in children and adults with late-onset Pompe disease. We also have them evaluated by speech and language therapy to look for hyponasality, to look for sensory neural hearing loss. We're also doing biomarker work in terms of looking at the urine hex4 and the CK, and there clearly is an emerging phenotype, a new chapter in the field of Pompe, where we are recognizing that many babies with late-onset Pompe disease actually have early findings, some things that were probably overlooked, and goes back to the original publication which we did from the Pompe registry of a 12-year diagnostic delay in these children with late-onset Pompe disease who had an average delay by about 12 years. So I'm hoping that through newborn screening we're able to identify them earlier, manage them better. It doesn't mean everyone needs to go on enzyme therapy, but they can get physical therapy, occupational therapy, and be monitored closely as needed for as and when and if they need enzyme therapy.